Brant Community Healthcare System Foundation is committed to raising critical funds to support the top priority needs at the Brantford General and the Willett in Paris. Your meaningful support of the foundation helps to purchase medical equipment, provide essential resources, and invest in new and innovative technology that helps maintain an exceptional level of compassionate patient care. So today, I've invited Kari Wilson, Executive Director of the Brant Community Healthcare System Foundation, to tell us more. Kari, thank you so much for being here.
Thank you very much for having me, Joshua, and certainly thank you for having this platform. I know you've had the opportunity to chat with a lot of other charitable organizations, and it's a great chance for us to be able to get out into the community some of the information about our important causes.
There's a tremendous amount of work being done in our community behind the scenes, and the intent of this program is just to shine the light on the incredible people who are doing that work. So yeah, thank you again for being here, and let's dive right in. So can you tell us a little bit about what the Brant Community Healthcare System Foundation is and what you do?
Certainly. Well, you gave a great introduction. We are at the Brant Community Healthcare System Foundation. We're the fundraising arm of our community hospitals. So we support the Brantford General and the Willett. Both organizations are steeped in healthcare history in both of our communities. The Brantford General, of course, has rich history of starting back in 1885 with the John H. Stratford Hospital. And in 1922, the Willett was started. And although both of our foundations started after that fact, the Brantford General Hospital Foundation was started back in the 70s, and the Willett Hospital Foundation was started back in the 80s. And those were born out of a need for an official and accountable separate board of directors to provide oversight to donor dollars to benefit those two healthcare entities. In 2010, we amalgamated those two charitable entities and became the Brant Community Healthcare System Foundation. So that's the organization you see today. And we raised funds to support top priority patient equipment and capital redevelopment needs at our community hospitals. So that means bricks and mortar for redevelopment to serve our patients' needs in the community. And it also means patient equipment so that we're putting the right tools in our caregivers' hands.
That's phenomenal. Okay, so it's a great segue into my next question, because the word you used, the terminology, was donor dollars. So can you elaborate on that a little bit further? What are donor dollars? Where do they come from? And where do they go?
And where do they go? So it's absolutely a term that we use all the time, and you will hear, particularly in the healthcare sector. So donor dollars, there's a lot of misconception about what donor dollars are utilized for in our healthcare system. And that's because, of course, our hospitals are funded by the Ministry of Health and Long-Term Care to operate. But the need for donor dollars is a critical aspect of our hospital's abilities to function. Donor dollars are required to support everything from the local share of capital redevelopment needs. So take, for example, you may have seen, and fortunately the City of Brantford has supported us, and the Mayor's Gala last year, thank you to Mayor Kevin Davis and Council for utilizing funds from the Mayor's Gala for the emergency department. Those types of donor dollars are utilized to contribute to the 10% local share that is required for any capital redevelopment. So the redevelopment of our emergency department relies on those donor dollars to ensure that we can proceed with renovating spaces, even through to master planning and the new vision for the future of healthcare in our community. In addition to that, Joshua, donor dollars are critically important to purchase patient equipment. There is often a misconception that patient equipment is funded solely by the Ministry of Health and Long-Term Care, and that's not the case. In fact, right now, our foundation is fundraising to support the purchase of a new CT scanner. So it's not nice to have pieces of patient equipment. It is critically needed pieces of patient equipment required to treat our patients each and every day. So we're very grateful to every donor that contributes to us. It's not just the large donations, although we're very grateful for those, but every donor dollar counts when it comes to supporting our healthcare system. And certainly through this pandemic, we've really seen the need for a strong healthcare system to serve all of us.
So then I'm going to put you on the spot here, go off script, but can you talk about maybe some of the things that have been accomplished with donor dollars, maybe over the last decade?
Certainly. So The numbers I'm trying to remember right off the top of my head, but over the past 14 years, our foundation has actually contributed close to $25 million into the Brant community healthcare system. And that has helped to fundraise, those fundraised dollars have helped to purchase everything from MRIs, to the refurbishment of our MRI, to the previous CT scanner, and now we're fundraising for an additional CT scanner. But it's also wheelchairs and ultrasound machines. We did a redevelopment and refresh of the pediatric unit at the Brantford General, and of course the transition beds that have recently been re-implemented at the Willett. That was all thanks to donor dollars from the Willett and the Paris community. So there's significant investments that are providing basic healthcare needs for our community.
And like you were saying, that's not just coming from, you know, rich philanthropists and big corporations. Those are donor dollars that are coming from people, you know, just like you and me, who are attending local events or, you know, making random donations. They read something in the paper and they reach out and they write a check and send it to you, right?
Absolutely. We're fortunate in our fundraising program. We have a very robust and what we refer to as a diverse fundraising program. So we have everything from direct mail appeals to major gift solicitations, but we also have third-party events, and we host some of our own events, which unfortunately right now, hosting some of our own events and those third-party events are the aspects of our programs that have been provided with a little bit more challenge this year because of our face-to-face interactions.
So that's exactly what I want to talk about. So talk about perfect timing. So regarding fundraising, things are different now with the COVID-19 pandemic. So can you talk a little bit about the innovations and what's changed with your organization, and what kind of fundraising initiatives are you running right now, and what do you have planned?
Thank you for the opportunity to do that. So you may have seen, and thank you again, Joshua, for participating in a new program that we launched for the month of May, and that was Read for BCHS, born out of a couple of committee members of ours who happen to be educators. And so that was one of our brand new programs, and we are looking forward to that becoming an annual event. And that was a readathon, pledgeathon style event, and we had a lot of community and political influencers in our community join us for bedtime stories, and children and adults alike really enjoyed participating in that program.
It was so much fun.
It was fun. I
Mortimer,
love opportunity.
go to bed. Sorry.
I
can't
really
wait till next year.
It was so sweet for me to see some of our most influential community leaders in what I would say would be some of their most vulnerable ways. Reading a bedtime story, you got to see a glimpse of them as parents and what it was like as they were raising their own children. So it was a really great program, and we're really grateful for everyone who did do that for us. In addition, we have shifted. So we would normally traditionally be in the month of May, we would have had our annual gala that we have enjoyed a resounding success from every year. And of course, we weren't able to host that event. So we're transitioning to a virtual event. So I'm letting the cat out of the bag a little bit on that one with you here today.
Well, thank you.
And so in September, so you'll see some information coming out of this over the summer, that in September we'll be having a virtual event, and we're transitioning our Ladies' Night Out to Ladies' Night In. So it's required us to be creative and adaptive, but we've also had the opportunity to reach out to a number of our community supporters. So our third-party events is one of the areas, and Joshua, because of your involvement with some of those great community causes and the work that the Crew Real Estate and the Closet Door have done in the community, those types of events, COVID presents some challenges as well. So what we're looking to do is engage with what we'll refer to as social enterprise. So businesses that maybe are selling a product, support local is a huge push, and we're very supportive of that right now. And maybe if businesses are willing to do so and still see an opportunity to support charitable causes, a percentage of a certain item or a portion of proceeds could certainly come back to healthcare in our community. We have a local business right now, Ludlow's Menswear, and they're selling masks high-end cloth masks made by a Canadian designer, and the proceeds from those masks are being donated back to us. So it's types of things like that that we're trying to adjust and be a little bit creative, but we recognize that this is going to be a unique year for all of us.
So this is probably a question that you get all the time, but I'm going to ask it to you. And for the benefit of the viewers who are watching, maybe you could walk us through it. So if a local business, an organization, a service club, or even an individual wanted to do a fundraiser or raise money for the Brant Community Healthcare System Foundation, start to finish, how does it work?
So the very first thing is call us. We have a small but mighty team of individuals who, over the past 3 months, we've really dedicated our time to learning about what best practices are, where successes lie within our industry, and also we know our community very, very well, and we know our donors. So give us a call, 519-751-5510. Staff members, some of us are working from home at times, but we're always responsive to our donors, and we'd like to chat with you and hear about what your ideas are, and we're happy to walk you through and work with you and guide you through what will be a successful activity or event. Some businesses are choosing to appeal to their employees, and they've offered a challenge to match any donations if their employees are choosing to give. But as I said, there's other opportunities that exist within the community to do online events or streaming. We might be able to help you with some of those platforms because we've certainly learned a lot of lessons over the past couple of months.
Awesome. Now, pretend we're not in a COVID-19 situation and, maybe we're in the new normal that's going to be after this. What are some kind of things that businesses and organizations and individuals could do? What kind of events could they do to raise funds for the Brant Community Healthcare System Foundation?
Certainly. So under normal circumstances, we have everything from children doing lemonade stands, which are phenomenal, to, New Year's Eve events and activities, silent and live auction activities out in the community. But we also have a large number of different types of businesses who look within their own business model and seize opportunities to do fundraising. So I give an example of something like Farm Boy, for example, where they have a coupon book that they sell, and those proceeds come back to us. Of course, we have Tim Hortons with Smile Cookies campaigns in the community. So businesses really can take a product and dedicate a portion or all proceeds to benefit a charitable cause. Certainly, I'd love it if it was healthcare, but any charitable entity in our community, because when we all work together, we're all going to build a stronger community. So we're looking at also developing partnerships within some of our charitable sector as well to see how we can maximize some of those opportunities. Because as you mentioned, Joshua, some of our service clubs have really also been very affected by the COVID epidemic or pandemic. And as a result, their fundraising has really become quite challenging as well. So partnership is where it's going to be to build a strong community.
I was going to say partnership.
Yeah.
I feel like I really want to make sure that I give you guys a good shout out right now, because I have had the luxury and the benefit to be a part of so many different events that raise money for the Brant Community Healthcare System Foundation. But I want to tell you one thing, it's not just the organizers. Your team and the staff at the hospital are huge supporters of events for the hospital. They're the first to buy tickets for a table, or they're the first to do a shout out on social media. And your staff and your volunteers and your team, they're at the events. They're there working with the organizers to make sure that it's a successful event for everyone. And I think the word partnership that you used earlier it is really, when you work with the Brant Community Healthcare System Foundation to do a fundraiser, you're an intimate part of it as well. And just a huge shout out to you and your team for how incredible you are, and for the staff and volunteers at the hospital for supporting hospital events. It's great to see.
Well, thank you very much. I know it comes from a passion and a commitment to our healthcare system. Each one of us lives and works in the community, and we rely on our healthcare system to provide us support when we need it. And we're also very grateful for the community, because if it weren't for individuals who were engaged in our community raising funds for us, we wouldn't be able to have the strong healthcare system that we do.
So one thing that you said earlier in our conversation was in the last 14 years or so, almost $25 million raised in donor dollars, which are coming from the pockets of people in this community. And how incredible is it that we have so many just wonderful people in our community who care so much? I think, and this is something you'll hear in conversations about the hospital all the time, everybody knows somebody who has utilized the services of the hospital at some point. So, contributing and supporting it, it really is just an amazing thing to see the community rally behind it. And I'm sure you're thankful for it, but I am also thankful for it. I mean, the hospital, saved my mother's life 2 years ago. And I owe a profound debt of thanks to the staff and the team at the hospital. And I know that it was the foundation that helped raise funds for things that she used and needed. So, I mean, personally, everybody's got a hospital story, right?
Mhm.
Okay, my final question. This is the
Yes.
one that I ask everybody who comes on the show. It's kind of similar to the last question, but just a little bit different. If an individual wanted to become more involved with the foundation, whether they wanted to apply for a job or if they wanted to be a volunteer or if they just wanted to write a check and make a donation to say thank you, how do they become more involved with the Brant Community Healthcare System Foundation, and where do they go to get more information?
So once again, I would say contact predominantly our foundation if you're looking at getting involved with raising funds or doing a community activity. And we have a link. So our website is a little clunky, I will admit, www.bchsysfoundation.org. But we have a direct link. So you can go to bchsdonate.com and certainly follow the links to be able to contact us directly. We have an email that goes directly to our foundation inbox, and it's foundation@bchsys.org. Or once again, you can certainly call us at 519-751-5510. And I'd encourage everyone these days to give us a call, because if we don't have that old school call, we're really lacking in that human interaction these days. So, and certainly if you'd like to volunteer or you'd like to apply to become a staff member at the Brant Community Healthcare System, they too have a separate website, and there are easy portals that are available on the website to follow, and an application for volunteering. So we have links on both of our websites to each other's, so you can certainly follow those. And we hope to have many people in the community become engaged with us, because as you had mentioned, our healthcare system is something that impacts each and every one of us. At some point in time in our lives, we will require care from our healthcare system. And we are very, very fortunate to have an amazing team, both at the Brant Community Healthcare System and in our foundation, to help to build that strong healthcare system for our community. We should be very proud in our community.
I think we should absolutely be very proud and tremendously thankful. And that's what I want to end the conversation with today. To you, your team, your volunteers, and the courageous and incredible staff at the hospital. Thank you so much for everything that you do. And I look forward to being involved in so many more events and helping to raise more, attention and money for your incredible organization. So thank you so much for coming on the show today. And I hope maybe we can touch base in a couple of months and get an update and see where we're at.
Sounds great. Thank you very much, Joshua.
Have a wonderful day.
You too. Take care.